Cataract surgery is one of the safest elective surgery in the human body. In 99% of patients, there are no complications. Patients recover in 3 to 4 weeks completely. In 1% of patients, some complication can still happen. And in some patients, you can have minor side effects. Let's start with minor side effects first. Increased light sensitivity. Before the surgery, the amount of light that enters the eye varies from 0 to 60 to 70% depending on the severity of the cataract. So after the cataract surgery is over, 100% of the light enters the eye. And some patients in the early post-op period are not able to tolerate this. In these patients, they will have to prolong the use of their dark goggles till they become comfortable. Dry eye after cataract surgery is very common complaint. Various symptoms associated with this are feeling of irritation, burning sensation, foreign body sensation, and watering. Symptoms sometimes can be so severe that it may affect visual recovery also. These symptoms cause a significant degree of mental stress to the patient. Answer to this question is that this condition is multifactorial. First reason is that the patient had probably a preclinical stage of dry eye before the surgery itself. It is possible that in this stage that there are no symptoms. After the cataract surgery, dry eye condition deteriorates and symptoms begin to set in. The reasons being the stress of the cataract surgery on the eye surface to the extent that the patient starts questioning about his decision to undergo cataract surgery. Now, why is dry eye so common after the surgery? Reasons can be use of strong light of microscope, creating incision for surgery, use of anesthetic drops and strong antibiotic drops, as also use of post-operative drops which are used in the treatment of cataract. In some patients, there is development of meibomian gland disease, which is a dysfunction of meibomian gland in the eyelid. The treatment of this condition essentially involves regulating the post-op medication, lid hygiene teaching, and appropriate use of tear lubricants, which may be needed for a period of 3 to 6 months. One point should be very clear that cataract surgery is a surgery which is done inside the eye, and this condition is happening over the surface of the eye. So it will be wrong to think that there is a problem in my cataract surgery and that is the reason for all these symptoms. The condition will eventually settle down over a period of time. Fluctuating vision can happen if the wound healing and wound modulation are still continuing. As a result, the glass power frequently changes. These fluctuations usually settles down in 3 months. Negative dysphotopsia is a very unique symptom. Here patients experience an arc-shaped shadow in the temporal field of vision. When clinically examined, these patients have a perfectly normal eye and the lens is very well centered. Dr. Mashkat, a world-renowned researcher in his study, has found that negative dysphotopsia occurred in as many as 15% of the patients early on after the cataract surgery. Although majority improves over time, bringing the incidence down to about 3% at 1 year. He also opined that it can occur in any type of IOL. The cause for this is essentially edge of the IOL and light interaction. Usually most of the patients report improvement with time. One can do simple measures like using a glass with thick temples or side support. This will help in blocking the light from the side and help in relieving the symptoms. Now let us look at some complications. Now these complications can happen during the surgery or after the surgery. Cataract surgery is usually a bloodless surgery. In the rarest of rare events during the surgery, suddenly bleeding can happen from inside the eye. This can happen spontaneously or due to sudden increase in blood pressure. In this event, usually the eye is closed immediately and cataract surgery is stopped. Subsequently, an opinion from retina specialist is sought and treatment is started. If the bleeding is very severe, there is a chance of loss of eyesight. Nucleus drop. This is also a very rare event. It happens more in patients who have difficult cataract, for example, very hard cataract, posterior polar cataract, cataract with loose support called a subluxated cataract. The lens capsule is a very thin membrane around the natural lens. This capsule helps to give the lens its shape. To do the cataract surgery, an opening has to be created from the front side of the membrane, and phacoprobe is inserted through this opening to remove the cataract. But sometimes the back membrane develops a breach, and as a result the cataract falls from the breach inside the eye, and this is called as nucleus drop. In this situation, a retina expert is involved and retina surgeon creates an opening behind, and with the help of a vitrectomy machine remove this drop cataract in the same sitting. Then an implantation is done. Increased inflammation. Like any other surgery, after cataract surgery also human body can throw reaction. In most cases this reaction is mild and gets settled with routine dosage of steroid drops. But if the inflammation is high, as is seen in few rare cases, patient may complain of pain, redness and hazy vision. For treatment, aggressive medication in the form of eye drops and oral tablets are given. Patients also need to be under close follow-up. With treatment, this condition eventually settles down. Infection. This is an extremely rare and dreaded complication of cataract surgery. It can be potentially sight-threatening complication. Patients may complain of pain, redness and hazy vision. Patients should immediately report if these symptoms happen to them. Majority of the infections are treatable if presented early. Treatment is given in the form of eye drop, injection, and sometimes a surgical treatment is also needed. If the infection is severe, there is also a possibility of loss of eyesight permanently. Increased intraocular pressure. This is again a very rare issue. It can happen due to steroids which are needed after the cataract surgery. Treatment is usually in the form of drops and it also settles down with time. Wound leak. Cataract surgery wound is very small, less than 3 millimeters. Very rarely there may be wound leak in the early post-op period. Treatment may be conservative with bandage, or patient may have to be taken in the OT and a stitch may be required. Corneal edema. Now cornea is the transparent structure of the eye. In some cases after the cataract surgery, fluid collects in the cornea and this condition is called as corneal edema. This leads to decrease in transparency and decrease in vision. This is usually seen in some cases of dense or hard cataract, or in patients who have inherently weak cornea, or in cases of prolonged surgery due to difficult intraoperative issues. This condition settles down in 8 to 12 weeks. Treatment is in the form of drops and ointments. If no improvement is seen beyond 3 months, then inner layer of the cornea will have to be replaced by a donor tissue in a surgical intervention. This surgery is called as DMEC. Another rare issue that can develop after cataract surgery is PVD, posterior vitreous detachment. This happens because of the vitreous jelly, which is a semi-solid structure in the eye between the lens and the retina, and it starts to contract and starts to separate from the retina from its backside. This can happen anytime after the cataract surgery and patients will see flashes of light and some black spots. Flashes happen because at certain points there is a strong adhesion between the retina and the vitreous. As the vitreous contracts, it is at these points the traction happens and patients get symptoms of flashes. Once the process of detachment completes, that's the time when the flashes settle down. A word of caution in this condition is that during the contraction of the vitreous jelly, sometimes retina may develop a tear which will need retinal laser urgently. Extremely rare event that can happen in this situation is that patient may develop retinal detachment. Coming to retinal detachment. Retina, as we all know, is an innermost layer and is responsible to collect image and transfer to the optic nerve. When the retina separates from its normal position, it is called as retinal detachment. This is a very rare but potentially sight-threatening condition. It happens suddenly and patients may see curtain-like shadow in front of the eyes. This situation needs immediate checkup and surgical intervention. Chances of reattachment is very good if surgery is done early. So in conclusion, as we have seen that complications in cataract surgery happen in a very small percentage of patients, and most of these complications, if identified early, are treatable and they don't have any long-term effect on the eye. It's only three complications, that is bleeding in the eye, infection and retinal detachment, can cause long-term vision issues in a patient's eye. Thank you for your patient hearing.